It was 1769. San Diego starts its modern history. By the 1850s, California becomes a state and San Diego County becomes San Diego County. Flash forward 160 years, you hit 2010. The Board of Supervisors okayed something called Live Well San Diego. It may not be quite the significance of statehood, but Live Well is a real paradigm shift in the way we look at public health. You see, never before has a county government gotten so many different stakeholders together to do one thing, to start a 10-year plan for improving the health of an entire region. And that region is complex, 4,200 square miles, the size of Connecticut. More than 3 million people, many hospitals, countless clinics and medical offices. Getting all these different players on the same page pointing in the same direction can be tricky.
We've made tremendous strides in promoting wellness across our entire organization, as well as throughout the greater San Diego region.
We've gotten a tremendous outpouring of support from all sectors, from healthcare to the military to schools to the business community. And those partners have overwhelmingly accepted the challenge.
So Live Well San Diego focuses on building partnerships in the community. When we're all pointing in the same direction, momentum builds. Funding is easier, you build common strategies. And the strategies are these: building a better service delivery system, supporting healthy choices, pursuing policy and environmental changes, and improving the culture from within. Looking in the mirror, holding ourselves accountable for making healthy choices.
We just finished up a grant-funded project called Building Better Health, and during that program we did a 12-week series, weight management series, and by the end of that program we found that 67% of them lost weight. So Live Well San Diego definitely had an impact.
Live Well San Diego is making wellness a real major priority for all of us individually as well as collectively. You know, one of my favorite sayings is none of us is as smart as all of us, and it really is going to take all of us working together to make a real difference in the whole community in terms of its health and wellness, and that's really exciting to me.
2 years in, Live Well is being embraced by a wide range of partners, from hospitals and Native American tribes to schools and incorporated cities. The city of Oceanside pledges its support for Live Well.
To have a city who acknowledged the county's Live Well San Diego platform is something they can embrace and something they could see as a county-city community convergence.
The community has come together really with a kind of some common goals, which is very important and very unusual. And so we've seen that people that have come from outside of the county and come here, we see them and say, boy, you guys are doing some really great work. And so there's no question in my mind that the County of San Diego is a leader in the country as to what we're trying to do here.
Live Well San Diego.
Some folks are showing their support for Live Well in unexpected and creative ways. A health worker teamed up with a resident of the Polinsky Children's Center, turning out a music video geared to teens on the benefits of healthy eating.
Living plan, mind, body, spirit, connected as one.
I think kids and their attention span, if there's an adult speaker trying to tell them about health, no way. You don't have a chance. But if you got a cool music video and you got some guys being goofy and writing some cool verses over a sweet beat, I think that ups your ante a lot.
Yo, this is real. This is your life. You got to think about it, because these decisions that you make today and tomorrow will lead to the actions that will impact you in the future.
Live Well San Diego means getting out in the community where health happens. In San Marcos, it was all about celebrating the good of the garden, a photo exhibit. Senior volunteers and special needs kids from Woodland Park Middle School get together for an intergenerational garden. The photos show how gardening promotes healthy living in positive neighborhoods. In Broadway Heights, people taking part in the county's resident leadership academies, classes like this one in a garage that empower residents to improve their communities in ways to encourage healthy eating, physical activity, and safety.
One gentleman that was in the group as of just a few days ago, he stated that he had lost about 37 pounds just by changing his diet. Folks start talking about changing the way that they handle themselves when they go to the physicians. So it's been a change in the community, and you can see the consciousness around that. Even when we do activities now, you can see the conscious change.
Live Well San Diego is also helping people with positive, healthy choices, making it easier to make those healthy choices and take charge of their own well-being.
I can't hear you.
Let's Move is the initiative launched by the First Lady to combat childhood obesity. In 2011, San Diego became the first official Let's Move county in the nation. Since then, the county has done everything from taking at-risk kids on surfing and hiking adventures with county parks and recreation to teaching both kids and parents how to prepare healthy meals at home. And for those whose life has taken some difficult turns, Live Well is giving them the tools to make positive, healthy choices. Young detainees near the end of their sentences at East Mesa Juvenile Hall work on creating good work habits by building gardens.
You know, we've planted all these plants and we've learned how to grow them. And you know, it's really cool because every couple weeks we have like kind of the culinary aspect of it too. So we go and we cook something with all the vegetables that we've grown. It's a cool experience that we get to learn all this stuff, and you know, maybe we can use it for the future.
From juveniles to the not-so-young, Ione is 93. She stays active, exercising regularly with our Feeling Fit Club.
We have the greatest instructors, and she explains the exercises, what they do for our bodies. I never used weights in my life, and I'm using these little 1-pounders, but they do the job for me.
Showing all ages how to live well, the goal of this year's Live Well Summit in Mission Valley. Thousands took part in person and on the web, learning about health, but also learning about opportunities to work with other generations and give back to the community.
We have a lot of older adults. That's a growing natural resource in our community, and they have a lot to give. They're knowledgeable, they have a lot of energy, and young people have parents who, many of them have 2 or 3 jobs, they're very busy, and they need more mentoring, they need more support. And this is just a wonderful, magical thing to be able to bring these 2 ages together.
The county has also been working with healthcare providers and community organizations to build a better service delivery system to help keep the quality of care high while keeping costs low. Chronically ill patients like Donald Ryan here were given one-on-one coaching to help them better manage their health and avoid unnecessary trips to the emergency department.
The network of care and the living well idea, that is all kind of gelled for me, and I feel very confident about how it's going to go.
Then there's MOM, M-O-M, or More on the Menu, a program that delivers fresh fruits and vegetables to homebound seniors who often have trouble getting fresh produce for themselves. Funding comes from community donations, with 200 seniors now receiving the service. Part of Live Well is changing the culture from within, looking at ourselves, encouraging healthy living by being good examples. A little cardio during the lunch break. County staff joined others in a 1-mile walk around downtown, part of the American Heart Association's National Walking Day. The county encourages staff and others to try to walk 10,000 steps each day.
The significance of today is walking. Walking for the benefit of our health, walking for the benefit of our heart, but also strategically, it means a lot more than just the physical walk. It's also the walk, the talk. We at the agency need to lead by example. We need to show what we're trying to accomplish by the willingness of what we do. People will doubt what we say, but they have to believe what we do. So if we walk the talk, we're much more likely to have a positive impact.
County employees step up to donate blood. The annual County Employee Blood Drive is one of the largest in San Diego County. Hundreds of pints are donated.
The blood that's drawn here really helps patients throughout the county, patients at all different hospitals and with all different needs.
We also held 15 blood pressure screening sites at county buildings on Valentine's Day, being good to your heart on that special day and driving home the point that people should know their numbers.
Blood pressure is one of the silent killers of the population. 1 out of every 3 adults in the United States actually has blood pressure problems or elevated blood pressure, and they don't even know it. And so it's important for everyone to know their numbers, know what their blood pressure is, just as it's important to know their blood sugar and their cholesterol level for a healthy heart.
Remember, we said part of living well is changing the culture from within, looking at ourselves, being good examples for healthy living. Well, it starts at the top. From the CAO down, each quarter a county executive is on camera encouraging employees, walking, healthy eating, exercise, and maintaining a healthy weight.
Sometimes it's fun to try something new.
We have employee walking and healthy eating programs.
in July of 2011 when I started my journey. We had just rolled out 10,000 steps in the office, and that was the first time we actually got up and started moving around. And it was right after that that Weight Watchers at Work came into the office, and I didn't hesitate a bit to go ahead and sign up for that. And it's been an exciting year. I can't even tell you, just losing the weight, I've lost 65 pounds. My clothes are looser, the scale is going down. I went to a physical last month and my doctor told me that I'm never been healthier.
Healthy choices are never easy. It's an ongoing battle for every person, including myself. But what we try to do is to make the employees understand that everything is one step at a time, and they have to start from somewhere. So the information and the resources that is available to them is to give them that baseline for where to start and then build on that progress.
I'm really impressed with the way San Diego County employees are always innovative and creative. So I'm really looking forward to their ideas on how to achieve a healthy, safe, and thriving San Diego County.
Live Well San Diego has been a call to action, not just for county employees, but for the larger San Diego community. In our second year, the reach of Live Well has extended further than we could have ever imagined, way beyond the walls of the county.
It's hard to do things all by yourself. And what's really neat about what's happening in this county with Live Well San Diego is I'm seeing people from all sectors of society, whether it be the government, whether it be education, whether it be business, whether it be the military, families, faith-based organizations, media and all. They're all excited about working together to really make this county America's finest.
Building a better service delivery system, supporting healthy choices, pursuing policy changes, and changing the culture from within. The 4 pillars of Live Well San Diego. It's more than just a slogan, it's not a fad, it's a real commitment to employees and to residents to ensure a healthy, safe, and thriving San Diego County.